We don't have a lot of time, unfortunately. This ends at, Jamie, what time? I think at 4, right? And then you have about 2 hours to prepare for dinner. I guess it's a black tie dinner or something. And so, black shirt dinner. Yeah. See, I'm all ready. First of all, I want to thank all of you, CICA, for inviting me. First of all, to be here and to be talking to you after your dinner time. I hope they're not serving turkey so that you're all sleeping by the time I speak. And Jamie will make sure that I stay on target. But for this workshop, this idea was we have about 45 minutes or so. We're going to talk about knowing your allies and your adversaries locally. Is there someone here who can help? Is this the only roving mic?
No, there's another wireless mic that I have back here, and I'm happy to bring it around for you, Marty.
Oh, thank you. First of all, is there anybody in the room here that knows what we're talking about in terms of allies and adversaries? Can someone just briefly? Actually, we're going to make him run around. Then we're going to go. Go ahead. What's your name?
Ellen Rollins, SEIU Local 521, Home Care Vice President and Public Authority Advisory Board member of 3 months, 1 month. And really proud to be in the partnership. CICA is an ally. Okay, adversaries are armed. I don't think I can put it in there.
I like the way you said that. Anybody else? And this seems to be stuck. I'm not quite sure why. I must be doing something wrong.
You might need to escape out and restart.
Oh, never mind. Okay. Just another suggestion of what we're talking about here, allies and adversaries.
Yeah, an example of an adversary might be certain legislators who oppose spending on social services, reflexively.
And way back there, are you getting enough exercise?
Yes, Jacqueline Jackson from San Diego. I feel an ally is someone who values and respects us and our mission and cause and is passionate. And the adversary are people that don't respect us, that don't value us.
Thank you. And one more up here.
Oh, no.
I just kind of want you to. Oh, that's nice. Thank you.
Okay.
I paid him to say that, actually. Before we go on, I just want to say why I'm here. I'm a family member of my 2 sisters. There are reasons why I'm an advocate. They both passed away. One has developmental disabilities. The other one didn't have health care. I show their pictures. As many of you who have heard me speak before, I speak of them, and it may one more time I'm going to say it. I'm going to say it as often wherever I go. And I expect you to do the same for the people that you love and you care about. Don't let the world forget why you are here. We are here, I am here, not to defend a program. I think all of us are here not to defend a program. We are here to defend lives and the rights of people who need those services, but it's the people that matter the most. And that's why CICA is so important. Now to get back to this allies, and so I show my pictures of my sisters because I want the world to know, the world in this room. And it reminds me always to stay true to the things that we've worked for. And so when I get tired or frustrated or upset, or I don't like dinner or whatever it is, I look at their pictures and remember that's why I'm here. That's why I believe in what I do. And it keeps me focused, keeps my eye on the prize. Sorry about that. Okay, I'm not quite sure what happened there, but let's go back to the allies and adversaries. You mentioned people who don't respect us and people who do, back there, correct?
Yes.
First, one other question I'm going to ask you, why is it important to have allies, and why is it important to recognize who our adversaries are? And then I'm going to kind of follow up on what you said, actually, in terms of recognizing who our allies are.
I think.
Wait, just wait for him to.
Recognizing our allies allows us to find people who walk with us, find people who have like minds, and that we may rise with each other, and our visions can soar in a way that if we're bickering, if we're fighting against someone, if we're trying to coax someone into a way of thinking, we don't look forward. We don't plan for that 5 years ahead or 10 or however long it takes. I think that having adversaries gives us strength and to know where not to go, and to also develop dialogue for those people that are different than when we're talking openly and with our hearts soaring.
And why is that important? That means you
Because
raise a good point there. Talking, you hear different points of view from different people in our community. I mean, and then how does that help us?
Because I'm advocate for myself. I've been a chair for 30 years. And so it took me going to a Native American disability conference in '92 to understand that there's blind people, there's hearing impaired, there's people who are disabled from birth. It's not just wheelchair people like I was advocating for myself. So my vision was bigger, not only because I was with the whole crew of Native American people, over 300 in Phoenix. So it just gets bigger, and your heart is bigger, and you can carry more, and you know you're not alone.
Thank you very much for what you said. You mentioned some very important points. I'm kind of doing this reverse of seeing what you know and then trying to elaborate. What you said was that you started to recognize, this is very important, that the community that is ours, that we belong to. I'm not talking about the city or the county. I'm talking about the community of people with disabilities, seniors, and mental health needs that you belong to. You started recognizing was more than just a person who's been diagnosed with a certain type of disability that puts them in a wheelchair, that our community was larger than that. And that's really important. Going back on your point, it's not just that we want people to respect us and therefore they become our ally. It is we have to respect them and start learning about them and their issues. I speak from experience. 10 years ago, when I started CDCAN, California Disability Community Action Network, I was a one-person operation. 10 years later, I'm a one-person operation. But, okay, that's not the change. But what is different is when I started it, it was the idea that I was tired that information about policy making was only going to lobbyists. Nothing wrong with lobbyists, but it was only going to a select few people in Sacramento or trade associations or statewide groups, not going to the people on the street. And so I started seeing a need. So I started writing information that would go to anybody. I didn't restrict it. And I realized also that our community was not just people with developmental disabilities, which is where my sister came from, or people with physical disabilities in a wheelchair, or the blind, or just people who are deaf, or people with mental health needs. It was people with traumatic brain injuries, it was seniors, people with Alzheimer's, people with mental health needs and special education. The list goes larger. And my feeling was, while it was more challenging me to write to such a larger audience, it came to me, as it should come to all of you, why would we ever want to limit our own community? I mean, raise your hand if you believe, because then the mic is definitely coming to you. If you think we should limit our community, and by the way, no one in this room, and no one in the next room, or the next room, or any room outside this hotel is in charge of the membership of our community. Our community, people with disabilities, mental health needs, people with special needs, seniors, the blind, the deaf, they are part of our community because they are part of our community. It's not because there's somebody says, oh, you're in a wheelchair, you're a part of our community, you can speak. Oh, you're not, you can't. Oh, you're not as disabled as the next person, or you're a family member or you're a support worker, and somehow you're not as important as this other person over here. I challenge that view. And my work has proven that you can challenge a view and you can treat people with dignity and respect and equally, and you don't lose anything. You gain a lot more, and you gain allies. And you take away false adversaries, and you start approaching the real adversaries that we all face. There is no one in charge of the membership. And once we recognize that, we can get to the next step of looking out who are our allies. Now, someone said it's people who disrespect us or people who do respect us. That's kind of true. But I would argue, though, that our adversaries really isn't a person. I know that we want to say it's Governor Schwarzenegger, and I'm sure if he walked in a room, you would stand up and applaud. Right? No? Okay. I didn't think so. And like Frances there, she's holding, like her aim is pretty good. So, yeah. That's when I would probably just step aside and say, okay, you guys kind of deserve to do whatever you want to do. But honestly, though, if we really think about it, our adversaries really aren't people or a person. It's what they do. And we got to remember that, because we want to look at Governor Schwarzenegger, and he only has less than, a little bit under 6 weeks left, 8 weeks tops. Maybe, I know. But what happens if he doesn't leave, right? I mean, he lives in that hotel at the Hyatt Regency, and, what if he doesn't leave? So, I'm just saying, once he goes, we say he's our biggest adversary, then our problem is solved, right? No, yeah, absolutely not. Our adversaries are people who don't do the right thing. It's the action that's really our adversary. You gotta remember that. You know why? Because all those cuts that happened to us in 2009 and 2008 and 2007, I know that some of you are only thinking of in-home supportive services cuts, so you're only going back to 2009. But for those of you who think in a broader sense of our community, you will know that SSI and SSP has been cut for the last 9, almost 10 years in a row. They have been the population and the program that has been cut more times than any other. And you go back to 2001 and forward and looking at all the cuts that hit regional centers, which were cut by almost $500 million. You look at mental health services, Medi-Cal, all these cuts, the optional benefits that were eliminated. Governor proposed most of those. Governor Davis was a Democrat, proposed a lot of those cuts earlier in 2001, 2002, 2003. I was there. I was there when he was talking about proposing the elimination of the residual program. Everyone knows what that is, right, within IHSS. He was talking about that. Unfortunately, Governor Schwarzenegger did more than just talk about it. He actually proposed it. What happened when these governors, and I'm not saying they're all evil men or anything like that, but what happens when they propose it? Is it law?
No, they have to have the
No.
house.
No, definitely, they are bad proposals, and the proposals are our adversary, and we should fight them. But who approved them? And who controls the legislature? I'm a Democrat. I have great respect for Darrell Steinberg, for instance. I have great respect for many of the Democrats in both houses. But if we think that by virtue of party or whoever is in office that they are automatically our ally, and by virtue that Governor Schwarzenegger is a Republican and a conservative, or he proposed something and therefore he's our adversary, we will miss our mark. That's not to say that Democrats are our enemies, because we're not using the word enemy here, we're using the word adversary. When a Democrat votes for a proposal that is harmful to our community, does it really matter that his party registration is Democratic, and he or she will come to us in a meeting and say, I'm your friend. And what do we say? We normally say, oh, you were, and then we bash Arnold Schwarzenegger. Now, we should bash Arnold Schwarzenegger, but why are we letting off people who claim they're our allies and really voted in a way that's very adversarial, in the way that you were talking about. So I really want to stress to all of you, as we talk and try to identify our allies and adversaries, look at the action. Sometimes a person will be our adversary because of a certain action they took, or a certain thing they're going to vote on. Sometimes an ally might be an adversary sometimes too. And so we have to really watch what a person does, as much as we have to hold ourselves accountable too. What do? Are we being true to ourselves and being true to people's rights all the time? Are we all that good all the time? Every one of you in this room? Because I plan to go up to that reception to win that raffle. I mean, and if I have to cheat, I will cheat. I mean, I passed the background check, but I will win that raffle, okay? I'm sorry, but I have to win that raffle. I don't know why, but. So does everyone understand what I'm saying now? It's not that we're talking about enemies. And if you're a Democrat, and I was a Democratic staffer in the Assembly, and I was, you can be very partisan if you want. You can say I'm for this person. But in terms of your role here as advocates, and identifying an ally or an adversary, you really have to remove the person and the party from that and hold the person or the organization accountable. And if they're not true, if they're not doing the right thing, then they're doing something that's adversarial to your child or to your family or to you as a worker or to you as a person receiving services. Remember, that's Ruth Shelton. Some of you know her. She's from Sacramento. She had IHSS. Francis, you knew Ruth. She was in an institution for most of her life, and then she was back in 1980, I think 1985 or so. 1985, she moved out of the nursing home, out of the developmental center, and lived independently until she passed away earlier this year. And look at that picture of Ruth. And she was an artist. She drew her paintings with the brush there on her head. And just look at her. And if a person or a legislature approves something that takes away hours or services that she desperately needs, and the person's a Democrat, was that action adversarial to Ruth? Now, you already automatically assume that a Republican's going to do that, so like, right? But we got to be careful too, because there may be Republicans in this room, and not all. We got to realize that people can do the right thing and people can do the wrong thing, no matter what their party is. And we don't. Our community includes both parties. Actually, there's a lot more than Republicans and Democrats. There's Libertarians and Green Party members. I'm sure there's. You're from Northern California. You're probably a Libertarian. So, I'm just kidding. I'm just kidding. Right. You're a member of the weed party. So, it's really important now that how we identify our friends and allies. Now, we do have allies. Allies can be taken two ways. Allies could be a noun. You can identify an organization as an ally. SEIU, UDW. Am I forgetting a union? I'm forgetting a union.
UHWUD.
You got to say it louder. Yeah. And there's another union, but I won't mention the names right now. But I'm just saying, we would assume that would fall in the definition of ally, wouldn't we? What other groups? And why would we say that though? There are groups or entities or individuals that would naturally fall under the word that we would say they are our ally, that their actions, like a Democratic legislator or a Republican legislator might act in a way or vote on a bill, and therefore, in that instance, they are our ally. But would you call a legislator our ally all the time? No, and you shouldn't. And it's no disrespect. For instance, Marty Omoto, an assemblywoman from Yolo County, is my friend. She really is my friend, and she's a friend of a lot of people in this room. She has been a strong supporter of IHSS. I'm a friend of Marty Omoto, but when she's acting as a legislator, she's not my friend. She's a legislator, and I will hold her accountable for that. And there's a few times when she's, most of the time, she's actually voted very courageously. There's one or two times where I
Again,
I
the
question
Senate
some of her
Appropriations Committee,
And,
be mindful,
and that's
we
my
are
role
going
as
to
an advocate.
have
But I'm
a
just
regular
saying,
session. We're going to dispense
she
with the
is
one bill, which
a
is a
friend,
claims bill.
and outside
That'll
the role
take
of the
perhaps
legislator, she might be an ally.
about 5 minutes.
In a role of the
And then when we
legislator,
dispense on that bill,
that's not her
we
role to be
will
an ally to us. And if any of you think that, you're sadly mistaken. Or actually, if any of you think that, stand up and get the mic. No? Okay. What about the unions then? We have some union members here. Yeah, they're naturally our allies, and because of the role they play. What about the family members or actually individual people who receive research services here? I mean, identify other allies. I mean, Jamie, I mean, you actually come from a community that's pretty connected, actually.
CICA?
Well, no, San Jose.
Santa Clara? As far as the advisory committee, or?
Well, connected with other groups.
Oh, okay, Santa Clara, we have Parents Helping Parents are our
Right,
allies.
very, very good.
Hope Services are our allies. San Andreas Regional Center are our allies. Catholic Charities are our allies.
Yes.
All those groups that share the common consumer base.
She's actually named a lot of groups where in some other counties there may not be that type of relationship. There's other groups. There's the area agencies on aging, the area boards on developmental disabilities. There's one in every area of the state. Regional centers, which you mentioned, are the 21 nonprofit regional centers under contract under the Department of Developmental Services to provide or coordinate services for over 240,000 children and adults with developmental disabilities. They also are the lead agency that coordinate services for early start for people with thousands of babies who have developmental delays, regardless of whether or not it's a developmental disability. They may have a physical disability later on in life, but they are the lead agency in charge of early start, early intervention. And again, that's another reason why we should partner, or they would be a logical ally. Some other ones. All of you come from areas that may have regional, like a public transit system. Some of you have a paratransit system. I'm on the board. I was the board president. I got off real quick when they were making cuts, but that is a partnership or an ally that could be part of something that we would reach to. There's also the counties and the cities have disability or senior or mental health advisory commissions or committees. Have any of you connected with those groups? Probably, I think you probably have in Santa Clara. Special education. Has anybody connected, or would it think of a special education parent groups or family groups, or SELPAs, which are kind of controversial with some of the families who don't like SELPAs. Now, I'm using an acronym, which normally I don't. Does everyone know what a SELPA is? No. But you should. Special Education Local Area Plan, and it's a combination of some parents and local school districts to kind of look at, I'm just doing a really rough explanation of what that entity does. The problem is a lot of the families don't think that the SELPAs, these entities, really serve the families in the best way possible. The SELPAs would argue differently. Doesn't that sound familiar? I mean, in terms of, there's always people from one side that will say that the other side is not doing what they need to do. You hear that with consumers of IHSS about the public authorities. You'll hear that of people who receive services in the regional center system about the regional centers. You'll hear that about people in Medi-Cal who complain about the counties and the county social workers. So that kind of thing happens. Home health agencies, there's individual providers like home health agencies, adult day health centers. And you mentioned one, Jamie, the Hope, which is actually a big provider in the San Jose area. And can't forget independent living centers. Does everyone connect in this room? You're all on advisory committees. You all connect with an independent living center. Now, some of them vary in strength and quality. I'm sure you would say yours is the best or whatever. Is there anybody here who doesn't know what an independent living center is? Does everyone connect with one? Would you view them as your ally?
Yes.
Which I didn't say they were necessarily, we're saying every one of these entities are good allies. That's a separate issue. What about Chamber of Commerce's or law enforcement agencies or groups like that, or local chapters of the Gray Panthers or the Older Women's League or other senior groups? Now, Francis, do you have any?
Older Women's League is a stakeholder with in-home supportive services, a group that tends to be middle-class older women, but very interested perhaps in building out that service someday, which seems to be part of the future when we get past these budget deficits. So, yeah, there's lots of, and of course, everybody has a senior center in their city.
And what about mental health services? Would all of you in this room identify them? For instance, the Mental Health Services Act, every county has a commission or a committee. Have we identified them as our? And I'm not talking about the quality of every one of these agencies or entities, because that will vary.
I can't say enough about the mental health services. They cut a bunch of stuff, but the professionals are working 24 hours a day to keep all the people in line.
You mean the committee itself or the governor?
Oh, the committee itself, not the governor.
That actually raises a question. When the idea of allies coming together, and it's not necessarily you come together in a room like this, but how would you bring your allies together? You know, you can say, oh, I'm an ally with the Gray Panthers, or I'm an ally with the mental health groups, and just say it. You know, sort of like saying that at a family reunion, that, you know, we all love each other in the family reunion, and you know that as soon as they turn their back, you're going to be talking about them, but, you know, because Thanksgiving is coming up, so. How do you bring people together in your community? I mean, we've now identified the different groups, but how do you bring them together? How do you truly connect them, and so that when we need each other, like when the governor was going to propose eliminating in-home supportive services virtually, all but maybe the last 10% of people who would receive services, how do we go to our community, to our allies, and say, we need your help?
Well, in Santa Clara County, we had a town hall meeting, and we invited all those organizations and agencies to come on board to support it with us, to do it in conjunction with us, so all their names are a part of the organizing group. Also, I'd like to say another ally that I think we all forget are the colleges and universities and the community colleges, the Disabled Students Program. And we really have to outreach to our young folks. That's absolutely huge. So
it's really veterans too, by the way, veterans
Yes.
with disabilities. The Disabled Students Program, for instance, is called a categorical program under the community college system, and it was hit with a big cut a year ago, the year before, and I wrote about it. Let me explain one thing that you all could do that might help connect people, so it's not just on a crisis that you're calling them. Because you can't, it's not really fair. I don't know if we're really calling it, if it's really the function of an ally that only when you need them, you call them. And we're kind of viewing it one way. We will call you when we need you, don't call us. And what we need to really do is a fair exchange of information, so that when there's a cut or there's an issue, we cover it. We might even explain it to the Gray Panthers why this is going to impact you. Or if they have a reduction or a situation, make them explain it to us, make them explain it to your committees, how it will impact people receiving IHSS or people in your own group that you're aware of. I do that every time when I write my CDCAN reports. I don't know if everybody gets it. What I do is I pull issues down. Now, if you look at this week alone, I covered like a wide range of issues: medical optional benefits, mental health services, the optional benefits, the in-home supportive services. I mean, I covered different issues back and forth, and I explained how it relates to our community. I mentioned the cut to CalWorks. CalWorks, does everyone know what CalWorks is? It's Welfare to Work. It's the Welfare to Work program. Does everyone know what Stage 3 child care is? That's a subset of the CalWorks program, but it's for parents, primarily women, who have been out of the program or not receiving CalWorks for about, I think it's about 2 years. And the governor vetoed or took out virtually all the funding for that program, so that thousands of parents will lose child care subsidies or money. These are women, and men too, who are employed, who have gone through the CalWORKS program, got a job, and now by November 1st, unless there's money coming from the state, I know that the Democratic leaders are trying to find some short-term money, they will lose their child care on November 1st, which means they will have to probably give up their job. CalWORKS was cut too by, I think, $265 million. I think that's actually probably low. CalWORKS provides grants, among other things, and training, job training for low-income people. Why is that important to us, though? I go out my way to write about those that normally people with disabilities and advocates never write about CalWORKS or the state's free child care.
Because there's a proportional connection between poverty and disability. So children growing up in CalWORKS families have a much higher incidence of disability in their family, or likelihood that they'll work in occupations that are unorganized and dangerous, and they will acquire disabilities at a higher rate than families with higher incomes. So we have a lot of stakeholders that we never even notice. The juvenile justice system would be another one, which we probably don't work that closely with, that probably has unknown numbers of disabled children and parents that are undiagnosed because they're impoverished. Forgive me, sometimes out of my mouth comes stuff I know better, but
Yeah,
I wear many hats, and sometimes a medical model word just slips right through the lips.
well, after a couple of drinks, a lot of words will start coming into our mouths, right, tonight. I know the rest of you can really party. No, actually, it's really important to realize that, I mean, you alluded to that in terms of CalWORKS, that program, and the parents and the children, that's our community. There are thousands of children and parents with special needs, either disabilities, physical, or mental health needs, or both. If you saw the people in the CalWORKS program, and when they were at the Capitol, you would have thought we called a rally, that it was an IHSS rally. Or actually, I ran into a group of parents and kids, and I thought I called the rally. I said, what time does this start again? And they were there. That's our brothers and sisters. That's our families. And those are our allies. And we should be their ally. But guess what? Our next steps, and I'll talk about this tonight after you're all kind of sleeping at the table and I'm saying, wake up, wake up. Were we there for them when they needed us? Our definition of ally right now in this room, when we started this meeting, was what another group or person could do for us. When we leave this room, I want you to think about an ally also means what do we do for them? Because that builds not only the strength of our relationships, but it gives an investment back to why they would help us. And also, it's not like we're just giving ourselves for something that doesn't matter to us. That's our community. Don't let the state of California or the federal government ever define our community by a medical diagnosis. I've said this before. If our community is defined because someone told you, a doctor told you that you have a certain diagnosis, and they told you have a certain diagnosis, and you have Alzheimer's, but you have MS, but yours is not as serious as hers, and therefore you're not really a member of our community, or you got injured on the job, and therefore you're not even in our system. You're in workers' comp. Does that make, I know a person who is as profoundly disabled as anyone in this room, but they're not considered disabled. You know why? Because that person was injured actually in San Jose during working hours. He's from Sacramento, and he's now, because it was during working hours, he's in the workers' comp system, which, by the way, is like the biggest hellhole of state government, being next to maybe some other places. But do you consider a person who's been disabled in workers' comp, a person with disabilities, equal to you, equal to us, our allies? Which, by the way, we didn't mention that. It's on our list too. Workers' comp recipients. We don't. We don't. Go ahead. Sorry.
I'd like to address what Janie was talking about, town hall meeting. We're making plans to co-sponsor with the senior center on in-home support service issues.
That's very good.
And so this will be coming up in how we're spending part of our money. The other thing is, frightened me, I didn't realize, my worker in the morning has childcare, and if November 1st she loses her childcare, I'm losing my worker because her little girl doesn't sleep but 2 hours at a time and all night and during the day, so she can work because someone's taking care of her child, but she won't be able to.
Yeah, actually, she could be using the CalWorks program, actually, the stage 3. Another point, we're going to have to close down in a second or two, but the next steps of this goes back to then realizing and understanding and translating. When we hear of a problem in another group that we say is our ally, then we should start questioning or asking them, how does this impact us, or what can we do to help? And then you in turn need to translate it back to our community so that they understand that there's a reason why this matters to us. There's a point if you just say, oh, this group here lost their funding and we should be worried about them. I mean, that's sort of like as good human beings, we should obviously recognize and feel sympathy for anyone who is going through a hard time. That's not the same thing as doing something on behalf of an ally, though. And that's an important distinction. One thing I was trying to say in CDCAN is I go out of my way to write information. I think that's what you're trying to do with your town hall or your local meeting, is to bring people together, and you're going to talk about IHSS. I would say one other step after that is you guys go to meetings of other groups and participate. Now, Francis was very good. Way back about 9 years ago, there was some hearings on cuts to the regional centers, and Francis was there.
Because of Bruce.
Was that? Were you lost? You went to the wrong room?
No.
So,
You got me in. Remember, there wasn't any group.
right. And it's just kind of important to be visible, to be there, and to be a presence. And that's just, it's a minor step, and you can learn things too. And you might even question. I went to a group of 100 families who their children have autism spectrum disorders. This is a couple of years ago, and Marty Omoto was actually with me. She was an assemblywoman. And I was talking about IHSS, and I was saying IHSS. Normally I don't use acronyms, but I was just kind of just saying it. And finally, about 20 minutes into my presentation, someone raises their hand. A parent says, Marty, what are you talking about? What's IHSS? 100 families. These are all people getting services from the regional center. They all have children, some of them as profoundly disabled as anyone that you would ever meet. And they didn't know what IHSS was. And like I shouldn't have been shocked, but I realized then how even within the community that I come in contact with on a daily basis, there's that disconnect. And so I go out of my way to write down in-home supportive services, what it does, and that it includes people with developmental disabilities. How many people know that 40,000 people, children and adults, in the population of in-home supportive services are people with developmental disabilities who also receive regional center services? Yeah, some of you, your daughter, yeah. It's important to know that connection, and how many are seniors. I mean, and how many people have mental health needs. And it's kind of identifying that and then going back to these groups to tell them, this is you too. And then we got to also learn from them. I'm sorry, Renee.
Yeah, that's right. So I guess what I wanted to say was that the adversary would really be ignorance. I mean, the people not knowing what IHSS is all about, or the disabled community is all about. And I think a lot of it has to do with, if you have a son, a daughter, a relative, chances are they do have an understanding of that versus people who don't, and trying to educate them. And, I'll say it. I'm a Republican, and I live in the North State, and but I think there's a lot of Republicans.
Want to stand up and say that?
Yeah.
I'm just kidding. Don't.
Listen to Rush Limbaugh and Sean Hannity all the time. So
Okay, you didn't have to say that.
Well, what I'm saying is
And Juan Williams, right?
there's other people. There are conservatives that are very involved and very concerned about the disabled community. So
That's very important. So go back then, and we'll close. I know you all want to get dressed up for tonight.
I think another group that hasn't been mentioned but might be important are the private nonprofits that work with these populations.
Very good.
I worked for Rebecca Children's Services in Gilroy for a number of years, where we were trying to do in-home support by keeping the severely emotionally disturbed children in their home and building a community around them. And in-home support services was a big part of my resources for the families and for the individual. So let's not forget them, because they're affected also by these cuts.
I think that's a really important point. One on top of that, and you got to remember, our allies can be people or organizations that philosophically we may not totally agree with, but maybe we're in the same direction, or we should be, or maybe we can get there, or we can help each other, educate each other. There are nursing homes in every one of our communities. There are, in some of our communities, there are developmental centers, which are like state hospitals, or state operated owned. How would you connect with them in terms of, I think that might be more a question of where they're allies on issues as opposed to allies in a more general sense. But remember, because some of you, your faces are kind of turning kind of like you had gas or something. Our community isn't by our choice who we define it. Our community includes people who are in nursing homes. It includes the people who work there. It includes the people who own them. And maybe you don't like it, and maybe you don't want it, but it's not your choice to just say, you're not a part of our community. You need to leave. That's not our choice. That's not the reason why we can be strong and be profoundly committed to inclusion and community integration, which doesn't mean we can then shut out someone who's a part of the community. It's kind of interesting that we preach inclusion, but only people who agree with us. Everything I've done, and I have proven that you don't lose anything by doing the right thing. And all the meetings I do, all the town hall telemeetings, all the reports I send out, I don't exclude anybody. They go to developmental center parents, it goes to nursing homes, it goes to the state legislators, it goes to the governor's office, it goes to people with disabilities on the street, all types of disabilities. And I have not lost anything in my commitment or lost any principles that I value or your respect that I also would value in doing that. Inclusion is a heavy responsibility on all of us. And sometimes it's really heavy that we have to include people that we don't like. But it also opens up the door for potential allies that we didn't realize that are there. You might be surprised there are people in nursing homes or nursing home operators or people in the developmental centers who would be very strongly supportive of IHSS. But it might surprise you. Then again, maybe they wouldn't be. So, wait, I'm sorry, back there. And then we'll go to you, and then we'll close.
One of the things, my daughter's a quad from an automobile accident, and one of the ways I've encouraged her is that she has a friend who's in the nursing home, and I encourage her to visit her because their goal is for her to leave the nursing home. And I said, well, the best way you can do that is to be there. And so she goes and visits 3 times a week. They have dinner together. They harass the other members and the staff. And I said, that's your job. And don't tell them that they don't have set days. It's when they feel like it. And that's advocating, keeping her healthy and keeping her set on her goal that nursing home experience is temporary.
Well, everyone has a different way of advocating. We'll go here.
I think that the allies that we need are the ones that we haven't got yet. And one of the things, I've been my daughter's advocate for 27 years, but what's important is to make sure that everybody knows what her services are. Regional Center, IHSS, SSI, you name it. A lot of friends and family don't really know. And so I explained to them, that these are the services she got. When you make your case, you're building allies, and they start to become your support wing, so to speak. And who knows what party they may, it doesn't matter. But when they hear these things, they'll say, oh, yes, Terry's daughter Christina gets those services, and they become allies.
That's an important point, and we'll close, but the language that we use to describe what we do and the things that we value, the more nonpartisan it is, where we have to be careful, be respectful of other people's feelings and positions on things. There's a way to write something, not give up our principles, and do it in a way that doesn't offend someone else. And they start embracing and understanding better what we do. You say it's impossible? I've proven that it's not. I don't take a backseat to anybody in this room, anybody in this state, for being a strong advocate for inclusion. I have proven it, I have lived it, I've organized rallies, I've done everything for most of my life I've done it. I will take a backseat to no one. But I also write in a way that's accessible, that is not disrespectful to other people in the community whose philosophies I don't believe in. But I can reach them now. They will read and listen. And they actually did respond in writing letters of support opposing the elimination of IHSS. And these are people in nursing home or nursing home providers. So I think we have to realize there'll be instances where our adversaries that we view can be our allies. And sometimes our allies, or people in state government that we thought were allies, in fact, are really our adversaries by their actions. And we have to just make sure that it's more by what people do than who they are. And in closing, one other last step, well, I guess we'll cover it tonight actually, is as you leave here, if you have other ideas about how we can connect in our local communities, because some of you are doing remarkable things, I mean a lot of you are, let me know too, because anything I can do to help promote it, I will. I'll send out notices or whatever I can do to help you, I will help you. Because there's a lot of us in this room doing different things, and we need to help each other. Because why is this really important that we really reach out to people who should be our allies, that we recognize why this is so important? Why are we doing it? Because it's a good thing just to do it, like sort of like call your grandmother, like on Mother's Day, or your mother. It's not like, is there a good reason to do this as we close?
Get you where you want to go. Preservation.
Preservation. We are faced, even if it wasn't that, it would still be the right thing, but the urgency is for the next several years. If you look back to the last several years, in the next several years, we are being confronted with the budget deficits will not go away. Come January, anywhere from 12 to 17, $18 billion hole. Again. A year after that, another deficit almost as large. A year after that, another deficit projected almost as large. We are confronted with a crisis that is not going away. And so it really is a responsibility for everyone in this room, more than any other, because you guys are activists just like me, that we have to change what we do, and we have to reach out. And that's why I thought it was a good thing that CICA was looking at, how do you reach out to allies? I think a lot of you had great ideas, and we just have to work together pursuing it. In closing, this is a quote from Nelson, actually it's not Nelson Mandela who wrote this, it's a poem that he would read while he was incarcerated for those 27 years. And this is part of it. Out of the night that covers me, black as a pit from pole to pole, I thank whatever gods may be for my unconquerable soul. My head is bloody but unbowed. I am the master of my fate. I am the captain of my soul. If Nelson Mandela could hold on to that after 27 years, then so can we. And we're doing it not just for yourselves or for the workers or for the people that we care about now. We're doing it for the people in the future who will need IHSS or will need the other services. Thank you very much, and I'll see you for dinner.